every place I have studied, I have heard it multiple times in multiple different languages that water is life, and water truly undergirds everything that we do. Before I was even at UNC, I didn't know that people lived on the Galapagos. And then I started to work with some of the anthropologists like Amanda Thompson, Peggy Bentley, and started reading the amazing work that's coming out of the labs at UNC, and was really shocked to learn just the potential for collaboration and meaningful engagement.
So that's one of the hallmarks of research at the Galapagos Science Center is we talk about interdisciplinary research a lot, but given the scale of research on the islands and the interdisciplinary nature of who comes to do research on the islands, it's really this unique opportunity for people to work together across disciplines. For the past, 6, 7 years or so, we've been looking at how water and food impact health, and particularly in places like the Galapagos, where you see a lot of economic development. You see people being able to afford things like packaged foods, or not being able to afford things like fresh fruits and vegetables. What we conclude from that is that the Galapagos actually suffer from a triple burden of ill health, so that they're having this infectious disease, they're having these chronic diseases alongside high levels of mental health distress. And so we're really trying to get a sort of comprehensive picture of people's health. Like, all of our research has really been community-based, working with local research assistants, trying to be responsive to community needs. But while we were in the homes, we were just asking moms, like, what do you think are the biggest problems for health on the islands? And there were lots and lots of responses about, this water isn't as good as it is on the continent. We're worried about our children drinking it. The food quality isn't as good.
It's not always about availability, although that's certainly an issue. I think what's really interesting here is folks are making those same types of decisions, but around quality. So a lot of households know that the water isn't necessarily safe to drink, so they purchase bottled water, yet they might still cook with that or they bathe with it. Some of the most salient commentary was people talking about how water issues would lead to domestic issues. They would say that if I don't have enough water, sometimes I have to decide whether I will eat or my child eats. You can imagine the stress of not trusting that your water is safe and trying to provide safe water for your family. Sometimes science can operate in a vacuum, and what I appreciate here is that people are actually trying to make a meaningful difference. So with our project, we have the mayor's office and the municipality involved, so that hopefully the findings that we are generating don't just stay in a lab or just some stuffy scientific publication, that they actually are being implemented at the policy level.
What Darwin termed the Galapagos in his journals when he first saw them was a little world within itself. And I think that that's true, that what we're seeing here is sort of a microcosm of what we're seeing in other places. So the lessons that we learn here, we can then apply to other contexts, which might be a little bit more challenging to measure.